Today, we will be doing DRE on this patient. Doctor, what is DRE?
The Digital Rectal Exam or DRE is a medical test that checks for abnormalities in your rectum, anus and prostate gland. Your healthcare provider will put on gloves and apply lubricant before gently sliding their index finger into your rectum. No preparation is required. The procedure is typically fast and painless.
Then what is the indication for DRE?
The indication for DRE is, first, assessment of the prostate, particularly if there is symptoms of outflow obstruction. Second, when there has been rectal bleeding prior to proctoscopy, sigmoidoscopy and colonoscopy. Third, change of bowel habit such as constipation. Fourth, problem with urinary or fecal continence. Fifth, cancer of the anal canal and lower end of the rectum, which can be felt as a mass. Lastly, secondary survey for trauma patient, which we check for the anal tone in suspect of spinal cord injury and pelvic fracture.
First, before DRE, we need to introduce ourselves and confirm the patient's detail. Assalamualaikum, Cik. Saya Kausa, pelajar perubatan tahun 3. Betul ke ni Cik Ramli? Betul. Umur 45 ya? Betul. Then, explain the procedure clearly and highlight it may be uncomfortable but not painful. Okay, Cik. Saya akan buat pemeriksaan bahagian punggung dekat Encik hari ini. Jadi saya akan masukkan tangan saya ke dalam punggung Encik lah untuk rasa jika ada apa-apa yang tak normal dekat bahagian tu. Jadi untuk pemeriksaan ni, Encik kena buka baju daripada bawah pusat hingga ke tengah paha lah. Then, inform the patient that there will be a chaperone during the procedure. Okay, Cik. Yang ni adalah chaperone saya untuk hari ni sepanjang saya buat prosedur ni lah. Then, we need to gain consent from the patient. Jadi, Cik setuju ke untuk kita buat prosedur hari ni? Setuju. Then, provide the privacy to the patient to get undressed. Then, we need to ask the patient to lie in the left lateral position with their right hip flexed, like this, the supposed position for the RE. Next, we have to make sure we have adequate apparatus. First, we need to have glove, lubricant, gauze, and hand sanitizer. Before start, we need to wash our hand with hand sanitizer and then wear glove. For inspection, we need to separate the buttocks and inspect the perianal region for any skin excoriation, skin tight, skin lesion, hemorrhoid, any fissure, any fistula, redness, swelling and mass. Then, ask the patient to cough and inspect for any anal prolapse. Cik, cuba batuk sikit. For palpation, before inserting the finger, palpate the surrounding perianal region for any tenderness. Lubricate index finger and inform the patient you are going to insert your finger. Cik, saya masuk sikit
Okay.
Place your index finger on the anal margin and palpate it for 4 to 5 seconds to relax the sphincter complex and gently insert your finger into anal canal. In male, palpate the prostate gland which is located anteriorly, assess the size, whether it is symmetrical or not, and the texture. Next, rotate the finger 360 degrees by following the position of clock. 9 o'clock, 12 o'clock, 3 o'clock, and 6 o'clock. Assess for any mass, hard stool, and painful area. Ask the patient to squeeze your finger to assess for anal tone. Cik, kemuk sikit. Withdraw the finger and wipe it on the gauze to inspect for melena, fresh red blood and excess mucus. Then, wipe the lubricant away. Recover the patient and allow them to get dressed in private. Cik, boleh pakai seluar ya? Okay, saya rasa itu saja untuk prosedur kita hari ini. Terima kasih, Cik.
Sama-sama.
Okay, then thank the patient and dispose the glove into the disposable bin. Lastly, summarize your finding to your examiner.
So, what's the contraindication for DRE? First, severe anal or perineal pain such as anal fissure. Second, imperforated anus such as congenital condition with absence of anus. Third, prolapse thrombus internal hemorrhoid. Fourth, after abdominal perineal resection surgery. And lastly, if the patient does not give consent. So, that's all for digital rectal examination. Thank you.